has suffered from sleep disorder or know someone who suffers from it, so we'll find out how you can finally get that good night's sleep that you need. Stay tuned. Good morning, Malaysia. You're still watching The Breakfast Show with myself, Satira, and Lisa. Now, let's talk about sleeping issues. Now, a lot of us have trouble sleeping, and it's quite normal because for some of us, it may be related to stress or other factors. However, if it becomes a regular occurrence, this is an issue that you might want to address because you might be suffering from a sleep disorder.
Yes, because I know that we all have been drummed in that we need about, 7 to 8 hours of sleep a night. So if you're constantly not getting restful sleep, could that mean that you also you are kind of being troubled by sleep disorders? We have a doctor in the house to consult us on this matter. Please welcome Dr. Muhsin Ahmad Az-Zahari, who is the president of the Sleep Disorder Society of Malaysia. Good morning, doctor.
Thank you.
It's really nice to talk about sleep early in the morning.
Yeah, it's appropriate time to discuss.
Did you have a good sleep last night?
Oh, very good, because we was too busy yesterday.
So you had a good sleep after a long day at work.
Correct, yeah.
Now, a lot of people may experience trouble sleeping, especially with the lifestyle of late, of the modern world.
Yes.
People tend to watch TV a lot or just work late nights and then stress and all that. Now, how can we differentiate trouble sleeping and a sleep disorder?
Okay. First, I think every one of us have experienced some hours. Can be not every month, but at least few times a year, difficulty in sleeping. We are too anxious for the exam, too anxious for the work interview, and so on. So this is, I would say, very normal. If you sleep comfortably, it could be you have no anxiety about this thing. Also, not very good. So it is a normal bodily reaction. But the problem is when someone have a sleep difficulty and is interrupt the life of the individual. For example, interestingly, you can see the video just now when someone easily does off, while doing work, or while discussing in a meeting, despite enough sleep last night, still does off easily. And the most dangerous, does off easily on the wheels.
Yes, while you're driving on the road.
That's very risky. So this is what we said. It need further investigation. If that problem probably one time is okay, but if many times it can be too risky business and too interruptive for someone, to do ordinary works. So we can see many types of sleep disorder. Sleep disorders is not one specific category, I would say. It can be psychological, it can be your breathing problem, it can be heart problem, and recently we also highlight about obesity. If you obesity, you're prone to have a breathing problem because of many fats, in your stomach or in your tummy, so it will constrict your breathing, so
your internal system affects
what we call sleep apnea.
Well.
It's a risk for sleep apnea. Right. So sleep apnea is more like to breathing problems when someone have a tendency the breathing pipes, when you're breathing, is collapsing while you're sleeping. So finally your oxygen less, so you awake at night. But when you go in the morning, you tend to recover your sleep that you missed last night. So you easily appear to be excessive sleepiness during daytime because of difficulty sleep.
There's also the issue of teeth grinding.
Yes. That's usually more initially start with the childhood age, it is happen, and usually we need to explore perhaps more psychological reason, why, someone have this problem, perhaps because of too anxious about things, about in childhood, probably parental issue as well, So this is all been.
Does teeth grinding affect a restful sleep?
Yes, we have to investigate. We worry about some other what we call sleep disorders that needs what we call neurological assessment, as well as psychiatric assessment, because of they probably too anxious to go to school next morning, so it's a response.
But we're talking about kids, because I know adults who are still grinding teeth, in their adulthood. So why is this?
I think we need to investigate, why this issue. It should be finished while you're around 10 years old, the most, it should be addressed and the problem should be resolved. But it's prolonged, you have to really investigate. We're afraid sometimes we call restless leg syndrome, associated with the sleeping difficulty as well. So is it? They come together. For example, the muscle cannot relax while you are sleeping.
I see. Okay.
So it could be some internal body tensions or anxiety. You're saying,
yes,
right, Doctor? We do have someone on the line for you here. Hello and good morning.
It's David from Ampang, right?
Yes. Oh, Michael. Michael. Good morning, Michael.
Hi, I'm Mrs. Michael here.
Mrs. Michael. Yes, Mrs. Michael. You have a question for our doctor here?
Yeah, I do. Okay, what I want to know is, why is my husband always disturbed by this, not being able to sleep every night? The slightest move, the slightest noise, he wakes up and that's it. The whole night is gone for him.
Okay.
What is his problem? Actually, he's got no problem.
Yeah.
No anxiety.
He's a very light sleeper, yeah?
Yeah, that's right. That's the word.
Right. So once he hears it, he will never be able to go back to sleep again. Is that what you're saying?
Exactly. Never be able to go back to sleep until it's about 6 a.m. when it's time for him to get up.
Oh, dear.
That's when he wants to sleep.
Okay. Thank you so much.
Thank you so
we'll
much.
have a chat with the doctor in regards to this.
Very good questions.
Good question, right? I'm a light sleeper myself, but I'm able to go back to sleep.
Yes.
I
think that's the most important, the total amount of sleep that should be adequate, the quantity, what we call it. Also the quality. So in this case, the husband appeared to be the quantity also not there, and also the quality. So there's few issues we need to address here. First, when we sleep, it comes with stages. 1, 2, 3, 4, and they call it. So some people perhaps they have a tendency also only go to from stage 1 and stage 2, then wake up, for some slightest disturbances, So
the flow.
First it could be a personality or made up of that particular person, This is among the things. But the issue is he cannot go back to sleep. I think it needs to be addressed, because if in total number of sleep still lacking, we really have to make sure, for adult, for example, 6 hours sleep is necessary without interruption. And I think like this one, we have to really make sure it's not again obstructive apnea, what we call it, because of the your breathing pipes, collapsing, and you cannot go further. So your sleep always been never go in that. So always been artificial or superficial sleep only. So that one need to have what we call sleep lab. That means laboratory. So we need to investigate one night, to see how many episodes of breathing difficulty during sleeping and so on.
I see. So you actually sleep in the clinic, and doctors actually monitor your overnight. Now,
so just for one night, doctor, or for several nights?
Most likely it's only one night.
Only one night.
Because we want to see the sleeping pattern.
And
interestingly, nowadays we can do at home, ambulatory.
Okay.
At home.
So Mrs. Michael, then you have your answer. Maybe it's good to pay a visit to the doctor just to ascertain the condition as well as what's causing it.
Or maybe is it possible that one can actually practice or perform self-help prior to seeing the doctor? Maybe have a sleep diary or maybe sleeping pills. Does this too help?
I agree with the first one, the sleeping diary. You should monitor your sleep, and what the people always, we take for granted for our sleep.
Right.
So if you have difficulty in sleep, you should quantify, for example, tonight, how many sleep you finish, you feel 1 to 10, how satisfied your sleep.
Okay.
This is what we call cognitive therapy in terms of sleep difficulties, But at the same time, we should have what we call sleep hygiene,
Okay.
So it's not...
Sleep hygiene.
Yes,
What
sleep
is
hygiene.
that?
That's the thing that, like, to-do list and don't list as well, for you, about your sleep. For example, it's been recommended sleep regularly, every day, and wake up at the same time every day. I know it's very difficult. The first question you ask, we watch TV sometime until 1, 2
Yes,
o'clock in the
I think
morning.
that's a pattern adopted by a lot of families.
Role
Probably.
model. I think it's a role model. When parents sleep late, your children, and they will grow in that way as well.
But doctor, is watching television or even playing the iPad or going and surfing online just before you doze off or just before going to sleep, is that a healthy habit?
So according to the sleep hygiene, you're not supposed to be overexcited, before you sleep, or you're too.
So your brain
aroused,
cannot.
before you go to
Right.
So what do you suggest, doctor, then for families to do just before they
2 hours.
get into bed?
I mean, at least they recommend like 4 hours before you go to the bed.
That's
you
impossible,
should
Doc.
cool down. So, if 12 midnight you want to
It's
sleep, what
possible.
time? Or 9 o'clock. You have to slow down yourself. And not necessarily you go to the bed. You cannot be very long on the bed.
Right.
It is recommended. If you cannot sleep, don't hang on your bed. You do something light, for example.
Okay,
Like reading? Would reading be good?
Light reading, not something very
Okay.
stimulating and doing work on the bed.
I
Okay.
see.
Not healthy as well.
Right.
I see. Listening to music, perhaps.
Yes.
Yeah.
You should know yourself.
Soothing music,
correct.
not rock and roll, perhaps.
Sure. Okay.
Right.
Advice too stimulating
I
you
see.
before you
So do
sleep.
you feel that maybe if, for example, you're excited about a project that you're working on tomorrow, and then you're doing research, right? And then you get all sorts of ideas, and your brain's really excited, and then it's time for you to go to sleep. Does this affect your sleep?
Yes, I think most likely than not, if you have some task, special task for the next morning, it will interrupt your sleep beforehand, But
And you will feel like really tired the next day as well.
after you completing the task, and as well because of lack of sleep. But the thing is, in this case, like once in 2-3 months, because you have facing presentation the next morning for students, so that one I presume is quite normal, But if you're persistent, second day you never feel tired, you still cannot sleep the second day after you completing the task, after everything done, the third day, fourth day, I think that's quite significant. You have to really, help talk to your friend. This could be the first what we call insomnia issues. That
I
we need
see.
to address as well.
Right. So, doctor, now, when it comes to sleeping, for a lot of people, I know mothers to be, or even new mothers have complete deprivation of sleep. Right. So that's a phase that probably lasts up till 6 months to 8 months to a year.
During pregnancy.
Yeah, or even after giving birth. So, will those construct sleeping disorder, or just complete lack of good sleep?
During pregnancy, it could constitute sleeping difficulty, or to say disorder. I would rather not to say disorder, but it's sleep disturbances.
Okay.
And it is well known that during the pregnancy time, especially middle third or the last third of the pregnancy, we call first, second trimester, and third trimester, they have a tendency to have this sleeping difficulty because of the fluid in your body, for example, your substance,
Water
hormone,
retention
water
or-
retention,
yeah,
and so
right.
on. And after birth, definitely another things you have to
Yes.
address, with the baby, with the adjustment with the environment, so this
right.
all can happen.
I also have a question here now, doctor. We also hear a lot about rapid eye movement,
Yes.
REM sleep. So is that what you call restful sleep?
Yes, this is what I mentioned just now about staging of sleep. What we call we have actually first we go through non-REM, non-rapid eye movement sleep. So like stage 1, stage 2, stage 3, and stage 4, where it corresponds to your wave activity in your brain. Your
see.
electric activity in your brain,
Yes.
and then after that you go to REM sleep. So REM sleep is supposed to be deeper sleep.
Right.
where at that time your muscle supposed to be the most restful time.
Right.
So if you sleep, only go from stage 1, stage 2 and wake up again, this is a problem. You never rest, fully rest, because never go to REM.
Hence
So
your
what if you have like deep dreams?
Deep dream, yeah.
Is that what constitute in the rapid eye movement phase?
Yes, most of the dream that you unable to remember because it is happened in the REM sleep, rapid eye movement. That means you're not aware about the dream. But if you dream at the stage 3, stage 4 of the sleep just now, you suddenly you awake, you can remember what's in dream, you feel fearful and so on.
Right.
Is that good? Is that good then?
Actually, the dream is supposed to be at the REM, the last stage just now. So preferably is that, but it's not necessary all the time. We go to that level. And just to add up, you mentioned about sleep diary just now.
Yes.
Let's say you taking sleeping tablets, to help you to sleep without proper consultation. So the issue is, the stages of sleep, usually they will stop at the stage 3, for example, stage 2. So taking sleeping tablet unnecessarily can interrupt your sleeping pattern overall if you are not being seeing doctor on why you need to take this
So
medicine.
when is the best time to see a doctor?
Okay. I think if there are many reasons. So first we can talk about lacking of sleep. For example, just now, after first day, second day, you still sleep for 3 hours, 4 hours, whereas usually you sleep for 6-7 hours a day, and it's 3-4 days already happen like that. I think first you should speak to someone, someone reliable to share the problem. It could be emotional thing, it could be some distress that you're facing, which is sometimes you don't identify yourself about this problem, but when you talk to someone, I guess this could be, the issue. You just about exciting meeting someone, for example, but if it is still prolonged, after you talk to someone, after you try whatever sleep hygiene I mentioned earlier, don't drink caffeine before sleep and so on, don't smoke or something like that, it still persists, then I think you should see a doctor to get more information what actually happened to you, just to make sure nothing more serious happened.
Could be a medical problem.
Could be
that
medical
would
problem.
be serious
Could
then.
be as well,
Yes, okay. Now, thank you so much, doctor. Thank you for advising us on sleep and sleep disorder. Now, if you do have any questions or doubts or queries, there is a website, sleepsocietymalaysia.org, which is basically on your screen at this point. Yes.
Thank you so much once again, Doug. We've got to take a quick break.
Thank you.
Up next, this is what we have in store for you.